Hello, I'm Dr. Michael Shuler with Athens Orthopedic Clinic. Today we're going to talk about what's called a gamekeeper's tear or a skier's thumb. It's ultimately a tear of the ulnar collateral ligament of the thumb. It occurs right in this area right here, and basically it's a injury that results in the thumb being pulled this way and it tears that ligament right there. So as the name implies, the classic sign is a skier holding onto a ski pole. They fall down, the pole pulls that thumb out away from the palm, resulting in a tear of that injury. It obviously can happen in other instances. People say they tripped, fell, got their thumb caught on a door or any type of object, resulting in the thumb being pulled away from the hand. In many cases, it happens so fast that people don't really know what happened, other than the fact that their thumb hurts pretty bad. Again, it's typically a swollen joint in this area that can result in significant pain with, again, pulling the thumb away from the palm. So this is an x-ray of a normal hand. An x-ray typically won't show a gamekeeper's or ulnar collateral ligament tear of the thumb MCP. However, it may in some cases. The ligament runs right here and again prevents windshield wipering of the thumb that way. There's another ligament on the outside that's called the radial collateral ligament that also can be torn. You might notice this little bone right here. This bone's called a sesamoid and is completely normal. But what happens is, again, typically the thumb is abducted away from the palm, and typically you get a tear right here on the distal insertion of the ligament. You can sometimes see a little piece of this bone that's pulled off, resulting in what's called a Stenner's lesion. One of the problems or concerns with this is there's a muscle that runs like this that pulls the thumb towards the palm called the thumb adductor, and that muscle actually inserts right in the area of this ligament. And if the ligament is pulled back and retracts back behind this muscle, that muscle can block that ligament from healing back in. If the tear of the ligament occurs, one of the best and kind of easiest ways to confirm the diagnosis is an MRI. Similar to a knee, where if you tear a ligament in the knee, you get an MRI of the knee. In this case, we get an MRI of the thumb, which will ultimately usually show either a partial or full tear of that ligament. If it's a partial tear, sometimes we can treat these with immobilization, casting, or splinting and hope that these heal in. If it's typically a full, complete tear of the ligament, that's typically a surgical indication. So, assuming you do get an MRI and it does show a complete tear of that ligament, typically surgery involves a small incision on the ulnar aspect of the thumb MCP. We split that muscle that can block the repair or the healing of the ligament. We put what's called a bone anchor, which can be either a small piece of metal that can be similar to a drywall anchor that has a stitch attached to it. In some other cases, there's some that are made purely out of suture. But ultimately, something will be placed inside the bone that anchors the suture to the bone. We use that suture then to tie the ligament back down to the bone and restore function. The suture or the incision is usually approximately an inch in length, after which you're placed in a cast for approximately 2 weeks. So, assuming you do have a complete tear, I'm typically fairly aggressive with the management of these, partly due to the fact that the recovery is fairly quick. It's a 10-minute surgery. You're in a splint for 2 weeks, followed by mobilization after that with a removable brace. If we decide to proceed with conservative management, there is a chance that the ligament will not heal. You'd be in a cast for 6 weeks, hoping that the ligament heals, and then ultimately, if it does not heal, then we'd be back in the same position with regards to needing surgery. One additional thing to consider with regards to conservative management is if we do proceed with conservative management and casting for 6 weeks and it does not work, usually after approximately 6 weeks, the ligament is very difficult to pull back out to length. And at that point, even if we proceed with surgery, it might require a tendon graft to reconstruct the ligament as opposed to simply repair it. So again, assuming surgery is performed at 2 weeks, the splint will be removed, the stitches will be removed, you'll begin to work on range of motion activities. You'll have a splint fabricated by the occupational therapist that prevents that stressing of the ligament, but you'll be able to allow for flexion and extension. At 6 weeks, we typically turn people loose with regards to proceeding with any and all activities as possible. So that's about it for gamekeepers or ulnar collateral ligament tears or skier's thumb. Hopefully this made sense, and if you have any additional questions, I'm certainly happy to discuss it further.